bedrooms so that they are able to move around in their own surroundings without any help. So coming to the recent advances in low vision, I think I have covered much of these things, the autofocus telescope. More important is that I just wanted to tell about the JAWS software and the NVDA. NVDA is actually non-visual desktop access. If you just go into Google, it is a freely downloadable software. That is one of the very easiest and quickest way of downloading a software. It is just a speech software. You can download it to your desktop, your laptop, and then if you connect your speakers, whatever you are going to type on the Word file, it will make a text, audible text, so that patient can really hear. Or any that file that is already available in the desktop also, the patient can hear that text. So that is called as a non-visual desktop access. JAWS software is also a speech recognition, speech software only. Nowadays, in this type of softwares can be downloaded into your mobile phones also. Patients will be definitely, they need not be blind also. People with low vision definitely will get, help from these two softwares. And now there are Braille output printers are there. But from our clinical point of view, this is a very simple guideline, simple solution we can offer to our own patients in our day-to-day life. And again, coming to the patient's acceptance, make sure if you are recommending any low vision aid, whether it is a spectacle magnifier or a CCTV or some video portable magnifiers also, if you have an opticals, make sure you have at least one unit that is available there so that the patient can immediately procure it from that opticals. Because if you recommend something and the patient is not going to get that low vision aid, they will lose their confidence. And then getting these softwares is really cumbersome. But you can make your own effort, you can talk to the dealers, you can get those, for a small margin, it's always better to provide those low vision aids in your own hospitals or eye clinics. So that just like your spectacle shop sells any spectacles, or any spectacle shop that is nearby, you can ask them to provide this type of low vision aids also, because there are dealers that they are available to have this. Generally, I go for a low vision aid trial like this. If the patient is having a vision better than 660, a simple bifocal ad will do, a +4 lens. Between 660 and 3/60, quite often the prism glasses will help up to 10 diopters. And then if they are still worse than 3/60, usually I recommend them a CCTV or a portable magnifier. So it is actually a teamwork, an ophthalmologist, an optometrist, a rehab person. You may not be able to get a rehab person in your clinic, but all of you should have an ophthalmic assistant or an optometrist. You can just call them and talk to them about low vision aids, so they are able to try some of these low vision aids in their clinic. This is about the study we did in our center. We found that we actually worked on 4 areas on the mobility, psychological assessment, reading and daily living activities. We gave a low vision aid, and after 1 month later, we just called them over a phone and then found out whether that has really helped them. And we found that from the reading point of view, there is increase or improvement in their quality of life scores. So this is based on it. This is an evidence based to show that low vision aids definitely help or improve the quality of life. This is on your right side, you are seeing the patients who received a low vision aid. On the left side, the patient who did not receive the low vision aid. So there is a significant increase in the score in providing a patient with the low vision aid. And this is also published in the Indian Journal of Ophthalmology as an original article in the last issue. So I'll just end with this. And then you have any doubts in this or anything you want to ask? There are a few dealers who are actually having a low vision aids in this trade stalls itself, because we are not supposed to specifically mention that, but they are available for you to actually either get through them and then recommend to some of your low vision aids. I think this will be a fair guideline or some tips for you to just integrate into your clinical practice. Now, I would request Sandra, who is our pediatric ophthalmologist and also our low vision consultant at our Coimbatore hospital. She practices low vision aids with the children. So she will be talking on the pediatric rehabilitation part of it. Actually, I am Dr. Ilango. I am put up at Aravind Eye Hospital, Madurai. You can also reach me for any